Without further ado, I'd like to introduce to you our very own Christine Smith. Christine is the co-patient and public involvement and engagement lead for the NIHR ARC Yorkshire and Humber. And we're delighted that she's doing a lunch and learn for us today about why do I need to think about equalities impact assessments. Christine's going to do her talk. I will keep an eye on the chat, but what we'll probably try and do is save the questions till the end, and then I'll just be reviewing the chat as we go along, so I can have some questions and I can help do that as well. And like I said, if everyone can put themselves on mute, that would be really, really good. I think I can mute people myself, actually. There we go. So I'll keep an eye on that as well for you, Christine. So with that, I'll hand over to you.
Perfect. Thank you very much. Hi, everybody. I'm Christine Smith. I'm the public involvement lead for Yorkshire and Humber. And I found myself getting kind of sucked into the world of EDI. And so this it's an opportunity for me today really to think about what it means for me, because I'm still thinking through a lot of this stuff. So I am by no means an expert. So on that note, there are no stupid questions, because I guarantee that you won't have questions more stupid than the ones than I had when I first started thinking about this. So what I'm going to be doing today for the next, I don't know, half an hour, a bit longer maybe, is thinking about equality impact assessments. This is what I'm going to cover. What I'm hoping is that by the end of the session, you will have a better understanding of the Equality Act, and more specifically the public sector equality duty, which is within that. You'll be aware of the 9 protected characteristics, and I'm going to talk about health and equalities as well. And the key bit, really, understand how by undertaking an equalities impact assessment, you can promote equality within your research. So before I start, I'm from PPI land, so we talk about acronyms all the time because they're such a barrier. But these are the ones that I am likely to use because I always forget and I use them anyway. So National Institute for Health and Care Research, NIHR, EDI, Equality, Diversity and Inclusion. PPI is my go-to default setting acronym for any form of public partnerships. So participation, involvement, engagement, there's kind of co-production in there as well. So it's just public partnerships is what that means. The ARCs, Applied Research Collaborations, and EIA, which is Equality Impact Assessment. If I use any others, if you can kind of wave in the chat and I'll try and stop doing that. So we're talking about equality impact assessments, and we work in health and social care. So it seems sensible to start with a discussion around health inequalities. So health inequalities, this is the definition: avoidable, unfair, systemic differences in health opportunities or healthcare between groups of people. So these might be the result of differences in income or employment status or where you live. And we know that there are specific groups within the population who have very poor health outcomes, like gypsies and travellers, for instance, people from more deprived areas. And COVID, which was a disaster, did one really good thing. And that was that it really brought front and centre the issues around inequalities and health research. So we know that COVID had an unequal impact on different population groups, and we know that it exacerbated existing health inequalities in the UK. But we also know that it had a disproportionate effect in more deprived areas, on ethnic minority groups, on people with disabilities. So it's amazing that that has really, really, really bubbled to the top of the things that we talk about. What we also know is that areas with the highest burden of disease have the lowest numbers of people who take part in research. We call them underserved groups. These are populations, groups of people who either don't know about research or don't want to get involved in research because they don't trust us. And there's a lot of very good reasons why that might be. So the upshot of all that is that diseases that are more common among deprived communities are being researched in healthier populations because we're not bringing in the underserved groups. And this matters because findings from healthy populations might not hold true in communities that have greater health challenges and greater challenges to their well-being. So we as researchers have a challenge. And the challenge is, how do we do things differently so that our research happens in the communities that are facing the greatest health challenges? That is our challenge. So I'm going to talk a bit about equality legislation. It's just the one slide. You'll be relieved to know. So the legislation, the current legislation around equality is the Equalities Act from 2010. It applies to everybody who provides a service to the public. That can be private sector or public sector. And it's designed to protect people from bullying, harassment, discrimination. And there's within the Equality Act, there is the public sector equality duty. And what that does is it says that organisations must have due regard to prevent unlawful discrimination, advance equality of opportunity, and foster good relations between different groups. And the key thing about the public sector equality duty is that organisations have to publish information to show that they are compliant with the PSED, but also that they are they have to publish objectives around equality. So within the Equality Act, it talks about the 9 protected characteristics. So it makes it unlawful to discriminate against people with protected characteristics. So just to quickly go round the circle, so they are age, obviously, disability, which can be physical or mental disability, sex, which isn't just I'm really sorry, the cat is outside the window. It can be male and female, but it is also people who identify as neither, so non-binary, gender fluid, etc. Gender reassignment, so the process of transitioning from one gender to another. And race, so people defined by their race, their colour, their ethnicity, their national origins. Religion or belief, so this can be any religious or philosophical belief, and it includes a lack of belief. Pregnancy and maternity, it's self-evident. It includes breastfeeding mothers. Sexual orientation is the attraction towards the opposite sex, your own sex, or on the spectrum of sex and gender. And in addition to this, it's EDI good practice to consider the underserved groups that I talked about a minute ago. So we've got the health and equalities background, we've got the legislative background. What is the National Institute for Health Research doing about this? So this is how they've responded. So the first thing that they've done is they've developed a specific role around EDI. We have Esther Makuka, who is the first head of EDI in the NIHR. In terms of policies, if you look at the one on the left, this is an update to Best Research for Best Health. Best Research for Best Health was the UK government's health research strategy published in 2006, and it essentially created the NIHR. And they updated it, the next chapter, in 2021. So clearly this is a huge document, but in the context of today, the key bit of this document is EDI. And there are two areas of strategic focus. The first one is about embedding EDI across the NIHR's research, its systems and its culture. And the second one is about bringing clinical and applied research to underserved regions and communities that have major health needs. The second document, the second bit of this combination, is that in September this year, the NIHR published its first EDI strategy. It's an incredibly ambitious document, and rightly so. One of its key objectives is to improve the diversity of research participants in the studies that they support, and to increase the diversity of the voices of those people who shape the research agenda. So that's research participants and the people who get involved in us helping make the decisions about our research. So this link here, top right, this one here, is the link to the NIHR guidance for funding bids. So this is the link to the is the guidance about the standard application form, and it was published in 2020. The NIHR now expects to see a clear consideration of EDI in funding bids. They want to see that we've thought about EDI in our planning, and that we have steps in place and plans in place to ensure that our population sample reflects our population of interest, so that we are researching the people with the greatest health needs. And the short version of this slide is that equality impact assessments are coming our way. At the moment, they suggest that we might complete an equalities impact assessment, and that will help us justify and explain any exclusions that we've made in our inclusion-exclusion criteria. And it will help to make transparent the decision-making process that we've used to get to that list. So what we need to do is work out how to apply an equality impact assessment in our own research, in our own practice. And we need to do this as individual researchers, as research teams, and as organisations. We need to be thinking about how we're going to embed EIAs in our processes. So what is an EIA? An EIA is a way to answer this question. Does a proposed protocol, intervention, strategy, activity, whatever it is you're going to do, does it or might it affect different groups differently? So these might be people with a protected characteristic. And in practice, as I said before, we need to go further than that. We need to be thinking about health inequalities in underserved groups, such as carers. We need to think about the impact of deprivation, of geography, location, and the rest of this list. There's a chap I work with in the East Midlands called Julian, and he has a mantra. And his mantra is, if I do it this way, who am I excluding? And that's it. If you do it the way that you're planning, who is it going to exclude? That's the nub of everything I'm going to tell you in the next few slides. So essentially, an equalities impact assessment is a risk assessment. It's a management process, and it needs to be embedded in your project management processes. It's a systematic process. It's an evidence-based process, and it should, if you're doing it properly, promote inclusion. And what it does, because it isn't a one-off, it's not something you do at the beginning of your project and then you never think about it again. It's an iterative process, and it offers you the opportunity to change the way that you are designing your research, delivering your research, so that the decisions that you make are going to impact on a wider range of people. You're going to be more inclusive. And it makes that decision-making process more transparent. And if you think about what I said earlier about underserved groups not trusting us, one of the ways that we might be able to deserve that trust is by being more transparent about how we're working. So the key questions then are, what are you planning to do and why? How, when, where are you planning to do it? Who benefits from this approach? If you're thinking about your recruitment strategies, for instance, who benefits from you having a particular range of recruitment strategies, and who is excluded by those recruitment strategies? And then what are you going to change so that you can improve your inclusion? So on the right of this slide, you will see an Equality Impact Assessment Toolkit. This was developed by the ARC in the East Midlands, and the QR code is a link that will take you to that toolkit. As far as I'm aware, this is the only toolkit that is specifically about EDI it's specifically about an equalities impact assessment for health and care research. So as I said before, you need to do this at the beginning. You need to do this, you need to start thinking about EDI as soon as you start thinking about your project. And you can perform your equalities impact assessment once you've got your research question and once you're starting to build your protocol. So it's an iterative process. So it's live, it's embedded throughout the whole process. And the important thing to remember is that your EIA has to be proportionate to the project that you're doing, the event that you're running, the strategy you're developing. It has to be reasonable, it has to be relevant. There is a very big difference between an EIA that is done as part of designing an event, a consultation event, and an EIA that might be done as part of a program strategy. It has to be proportionate. You've got to be, this is a pragmatic tool. And the time you do it is when you are starting to design your project, and when you're managing your project. And this is the components, these are the components of an EIA. So you, as part of your literature search, which you're doing anyway, you identify previous equalities related research that's related to your project. And you think about what you're going to do, and you think about how that might impact on different population groups. You identify who might be affected by that research, by your plans, and you think about protected characteristics, you think about underserved communities, and within the toolkit, you describe how they might be affected by what you're going to do. So whatever it is that you're going to do, your recruitment strategy, for instance, it might have a positive impact on a community. It might be very easy for them to be recruited. It might have a negative impact on a different community. It might not be inclusive for them. And then once you've done that and you've gone through the protected characteristics, you've thought about underserved groups, then you come up with an action plan that mitigates those negative effects. And you put a monitoring plan and an evaluation plan in place so that you can iterate throughout the project. And this is what your action plan might look like at the bottom. So it's to mitigate negative effects. It has to be specific, measurable, achievable, realistic, and time-oriented. It has to be smart. And as I said, it's a live document, so it allows you to react to changing situations. And what is sensible is to embed this process as part of your milestones, as part of your operational management of your project. So that's an equalities impact assessment. That's the short version. If I do something this way, who am I going to exclude? That is what it is. Now, one of the things that I wanted to talk about briefly is really thinking about EDI and PPI, because I think that there is confusion, and I think people conflate the two terms and think that you're talking about the same thing. Public involvement is about engaging with communities, bringing them in to help you make decisions about research, or you might be bringing them in as participants for your research. And EDI is a much broader playing field, but you can't do PPI without considering EDI best practice and vice versa. So, as I said right at the beginning, the NIHR expects that any funding applications should demonstrate how you've thought about EDI. And at the same time, the UK standards for public involvement have a standard about inclusive opportunities. And this standard states that research has to be informed by a diversity of public experience and insight so that it leads to treatments and services that reflect those needs. So how do you pull all that together? Where does it overlap? So for me, where it overlaps is the equalities impact assessment. Because in this equalities impact assessment, you are identifying which groups that you need to target to ensure that you have equality and inclusion in your project. So for me, PPI is a mechanism that can help you improve your inclusion and increase the diversity within your participants, so that you can then target, say, a community that you've never worked before, and you can use PPI best practice to bring that community in and help you make decisions about your research, which will then hopefully increase the inclusion of your protocol, bring people in, and you end up with a population sample that reflects your population of interest. So I just wanted to do just a couple of minutes just talking about what we're doing in Yorkshire and Humber. So last year I was asked to do an EDI proposal for our exec team. So I did. I can share that if that's of use to people. And what we did was we set up an EDI special interest group. And this is what we've started to do. So we've done some asset mapping of our PPI assets so that we know which groups we're linking in with. We are just about to start some EDI monitoring of staff, so that we have a baseline, so that we can actually describe how diverse we are as an organisation. We're going to be doing, in the new year, we're going to be doing an audit of project diversity. So we're not asking our research teams to share their data, but what we are going to be asking them to do is tell us what equality and diversity data they collect as part of their projects. And we have the first draft. We're working with the EDI team at Bradford University, and we've got the first draft of an EDI strategy, which we are about to go out to consultation about. And we've done an EIA pilot because we took the equalities impact assessment toolkit from the East Midlands, which was designed around them and their system. So what we've done is we've taken it and we've seen if we can just use it as is in our system in Yorkshire and Humber. So this is what we did. We worked with an implementation project, which was about reducing emergency admissions to hospital from care homes. And I had an initial discussion with Emily, who was the project lead. I shared the toolkit with her, we had a chat about it, and she then went away and completed the assessment. And then over the next sort of 9 months, we had a series of conversations about how it was going, how she was adapting her action plan, and what she was doing to increase inclusion. And then at the end, in May, we had a reflective conversation to look at how using the toolkit had worked and what we needed to think about in terms of our process. And this is what worked well. The toolkit worked well, which was a relief. There are lots of worked examples and lots of additional information with the toolkit, And Emily found that really, really useful. We set it up as a flexible process because we really didn't have a feel for how it should work. So we just decided to just suck it and see, have a go, see what happened. And having that flexible process that was very much led by Emily and her needs. So she came to us when she was ready. We didn't have a set timescale. And that really worked. And I love this quote. So this is a quote from Emily because I think it's really important that we are able to show impact. And we asked her what she'd really taken home from using the EIA process. And what she said was, we're getting a bit better at the demographics and the demographics that you hear about most often, but this one has really made us think about the ones that you've never even thought about. Like, I don't think I've ever even thought about how my research would impact on the LGBT community ever once. And it's been really interesting and I've really enjoyed it. And I was so excited when she said that. I was like, yes, that's an impact right there. We've managed to get somebody, a junior member of staff, to think differently about how she's going to approach this. Absolutely fantastic. Really excited when she said that. But there are things that need a bit more thought. We talked a lot about, if you're an early careers researcher, or actually if you've not done one of these before, it can be quite paralysing. So we had conversations about, could we get managers involved? Could we get supervisors involved in these conversations? What support infrastructure do we as an ARC need to put in place so that people can do these equalities impact assessments? The earlier you can start is great, is better, but you definitely need a research question. But as I said earlier, this isn't a one and done process. So developing a research question is an iterative process, and this is an iterative process that can support that development, and vice versa. And finally, any kind of process, you're going to need leadership from your senior leadership team. They have to be behind this, otherwise it won't work. And so this is another quote from Emily. And she said, on reflection, it really made me think about ways that research that doesn't initially seem to have an equality impact to it, like how big of an impact an EIA could actually have. And not only has it made me think about it for this project, it's made me think about it for all the projects that I've been involved in and how differently things might have been if she'd done one. So again, I just think that's amazing that somebody has found this an incredibly useful process. So that was kind of a quick dance through the equalities impact assessments. I hope it's been useful. I've got one last thing to say, which is that tomorrow there is another webinar from the East Midlands ARC, where they are talking about their system and how they set up their system to support equalities impact assessments. So again, this QR code will take you through to the Eventbrite if you want to log into that. And I'll stop it there and let's take some questions.
Thank you, Christine. That was brilliant. There's someone's asked about sharing the slides. Are you happy to
of course,
send the slides around?
Absolutely, yeah.
That's fantastic. So if anyone's got any questions, feel free to raise your hand in the Zoom way, or put it in the chat. That's absolutely fine as well, if you would prefer just to put it in the chat. And we'll see if anyone's got any questions for you, Christine. But I mean, it was very clear. So I learned something myself today.
Oh no, is everybody shy? Don't be shy.
It's because you've explained it so well. Okay, we've got a question from Gary. Gary, go ahead.
Gary.
Hi, Christine. Thank you. That was fabulous. Thank you so much. And it's less a question actually, but more a comment. And I was really pleased that you mentioned that there's a danger of conflating PPI with EDI, and I've really noticed that trend, even from very sort of senior staff, thinking, "Oh, we'll just lump those together." So I thought your explanation of how they intertwine and link. And that was indeed one of the questions that I had written down, and you answered it perfectly. So I just want to say thank you very much.
Oh, no, that's great. I mean, I think, yeah, I've noticed that as well. And I think it's been really clear to me that the NIHR has started talking about EDI, and the very senior people have kind of gone, oh, okay, well, we'll just give that to the PPI lead to sort out. And I've heard that a lot. I should probably say in my defense that I volunteered to do this as the PPI lead. I didn't get this dumped on me, but I know from other colleagues that has happened. But I also think that I know that I've got a lot more thinking to do about that little Venn diagram, because it's not, I don't think it's quite there yet, but that's kind of as far as I've got in my head. And because also in that big mix, there's how you mix co-production into that, and what that looks like, and that then my head gets really confused. So
yeah, I do wonder. Yeah, there might be an issue about working out whose responsibility it is, because it overlaps, doesn't it, with so many different things. But yeah, but that's my experiences of seeing people saying, well, it's all PPI, isn't it, the EDI bit, and having to explain to them, for me badly, about well why it's linked but quite different. So that was brilliant. Thank you.
yeah, and I also think if you look at a lot of EDI strategies, are talking about workforce, and they're not talking about the EDI within the research itself. But PPI is all about inclusion and diversity within the research itself. So there is a difference.
Thank you, Christine. So we've got a hand up as well from I don't know what your full name is. It's Marie J1.
Yeah, hi, it's Jenny Murray. I'm from Yorkshire and Humber Patient Safety Research Collaboration. So it's just a couple of points really. One is that when we talk about EDI, we talk about it as being the golden thread through the PPIE, and knowing that you can do PPIE and not do EDI. So it's thinking about it that way. The other thing is it's just more of a point, maybe more of a pushback, not to you, but I think centrally, that this statement that NIHR about every person being eligible to take part should be offered the same opportunity to take part in research. What that actually looks like on a practical level isn't that, because of the hoops that we have to jump through as researchers, so creating very long patient information sheets. So the very nature of the system that is set up, in which we have to adhere to certain things, even for the most straightforward of studies, means that those opportunities aren't actually available to everybody.
Yeah, I completely agree. I think the way that the NIHR is set up, it's not on purpose, but it actively works against meaningful PPI, and it actively works against inclusion and diversity. I mean, they are thinking about it, but absolutely, yeah, I completely agree with that. And I think that the competitive nature of the NIHR also works against good inclusion. I think that there's a lack of shared learning. There's I mean, hopefully being able to do things like this will enable us to share learning in a more accessible way than just writing papers and letting them sit there gathering dust. But yeah, I couldn't agree more.
And I think it goes a little bit further than that. It's like the system is slightly lagging behind, or the system hasn't reflected on what is being asked. And if you take the CRNs, for example, we're often asked to report RTT reports, reporting to time and to target, which are very quantitatively based, and there's no space for, are we hitting targets in terms of representation, and is there space within a project that's been set up with quite specific timelines as a waterfall timeline to really get to grips with developing trust, so that we can ensure we are diverse. So the system is lagging behind.
Yeah.
And we're all saying this, but actually somehow we're not actually all having those conversations, maybe to NIHR, to the CRN, to ethics committees.
Yeah, it's interesting, isn't it? One of the things that gets said a lot about researchers is that we talk a lot, but we don't kind of talk together a lot. We because we all exist in silos. I think that amplification doesn't happen. I'm not sure how we deal with that. But
I think there's enough of us
today.
Yeah, there's enough of us, and certainly across the patient safety research collaborations. And if you think about ARCs and all the other types of organisations, there probably is a collective voice. So instead of thinking along silos and all experiencing the same difficulties, there probably is a high level conversation to be had somewhere across these various networks.
Yeah. Well, I mean, the ARCs, all the ARC PPI leads come together. I don't know what happens in sort of patient safety land, but if maybe the chairs of all those groups need to get together and start having that collective conversation.
Yeah, so the patient safety research collaborations, there's 6 of them. I'm sorry, I'm hogging this, but I'll stop in a minute. And overarching that, there's a new safety net. So there is a collective voice, and we are now starting to share our EDI strategies and our PPI strategies to see what the collective messages are.
Yeah.
So I just wonder if the central network for the patient safety collaborations needs to talk to the central network of Health Innovations Network, to the central, do you know what I'm saying?
Yeah. I mean, I can definitely feed that back to our group. And I think, Gary, are you linked in with the RSSs? RSSs, the new research design services?
No, not
on now.
Not anymore.
Not anymore.
No,
Okay.
No, only as kind of friends and colleagues, but I've got no official link with them yet. But,
but that might be talking to because they've got the RSSs have got a national office, so the PPI lead would be there. So that's the person that we'd need to talk to.
That's fabulous. Thank you. So we've got a question in the chat, Christine, from Skinnery. That's the name on there. About I'll let you ask it actually.
Okay. Hi, it's Isla here. Very new member of the Patient Safety Collaborative in Yorkshire and Humber at Bradford. So I was thinking about the actual process of doing the EIA assessment, and thinking back to 3 years ago in commissioning when EIA assessments first appeared there. And some attempts that we made to involve people in the actual process of doing the assessment, which was, and it is a long time ago, and PPI itself was still relatively new on the scene then. But it was helpful. It did make us think of things that we wouldn't have thought of otherwise. It did sometimes enable us to actually involve some people from those underserved communities, to get that first-hand insight, and so on, and also around not just the negative impacts, but the potential mitigations, and so on. So I'm just wondering now, more than a decade down the line from that, whether there's any collected learning about involving people in the EIA assessment process.
I don't know about published learning, but certainly the pilot that we did, and I should have said this in the presentation, the pilot that we did, the group that was working with Emily, there was myself, and then there were 2 public contributors working collectively. And in the East Midlands, the system that they have an EIA team, which has professionals and community engagement workers and public contributors involved in that. So yeah, definitely this is a team effort. This isn't something that you should do as an isolated researcher. That was my big take home from this. You definitely need a gang of people to think this stuff through in the same way that you wouldn't think about, hopefully you wouldn't think about your PPI processes without having public contributors in that conversation. It's exactly the same principles. And actually the conversations that we had as part of the EIA process were identical conversations to the ones that you have when you're talking about PPI and inclusion. So there is so much overlap, but it's just kind of looking at it through different lenses. So definitely, it's definitely a group activity.
Yeah, and you've really kind of linked in there to what my second question was, which was about using the EIA structure, mindset, even, you know, the actual tools in thinking about your PPI itself to address the issue of it often not being very inclusive either.
Yeah,
That the research might not be as inclusive as it could be, but sometimes, well, it's a constant battle in PPI to make that more diverse and inclusive too.
Definitely. And you can use this process at different levels. So at a project level, but also strategically. So I also work in Arc East Midlands, and one of the things that we're doing is we are doing the EIA process for the strategic PPI group to increase the diversity of that group. So we're going through this process now, trying to work out who, how, where do we find people, how are we going to do it, and who do we need in the room, what voices do we need. And it's been a absolutely fascinating process.
Great, thank you. It's encouraging.
Oh, you're on mute, Kate.
I knew I'd do it at some point during this. Just one more question in the chat from Lynn. She said, please could you give any advice on how to make an EIA proportionate? And Lynn, I think you're still here if you want to expand on that, if you're around.
I am. Hello.
Hi.
I'll just start my video. There we go. Yeah, it was just, I remember you saying, Christine, that you would do a very different EIA for, say, a stakeholder consultation to a large programme of research. So I'm involved. I'm also a new member of the ARC, and I'm involved in a stakeholder consultation. And I was just thinking, yeah, if you had any tips or thoughts and ideas on how to make it proportionate without just sort of using that almost as a mindset to say, well, we don't have the funding to do that, so we won't do that. Yeah, what your thoughts are on that?
Yeah. I mean, the budget is the sticking point essentially. So if you were thinking about the budget that you got for a process, or if you were a PhD student, for instance, then clearly it's a different process than if you were looking at a larger scale. And I think for me, it's about looking at what you can do and just making some pragmatic decisions. And inevitably, you can't do everything. But what the EIA does is it makes the limits really, really visible. And it means that if somebody comes to you then and says, oh, why didn't you do this? You go, well, you know what? We did think about it. We went through this process and we couldn't do everything and we had to choose. And unfortunately, that group was excluded. But the kind of the flip side to that discussion is that when you're writing this up, however you're going to write it up, what that does for you is it writes that section at the end about future research, implications for practice. That section just writes itself. And you've got your next funding bid, you've got your next process there. And so if all of these link together, then you can build the arguments for doing it differently next time. In theory, if that
That's fantastic. Thank you. So just the last chance for questions now. I think that's all the ones in the chat. Unless anyone has any others that they want to put forward. I'm going to put the link again in the chat to the ARC newsletter because we'll share everything from today in that. We'll share the recording as well. So please do sign up for our newsletter. And I'll also put our generic email address in there. So if you do have any questions at all, you can email that and we'll try and answer it, or we'll send it to Christine as well.
Yep, and
Christine, have you got
I'll
anything to add?
no, but thank you for coming. Thank you for listening. If you want to have a chat about any of this stuff, I'm very happy to talk about this stuff because I think it's really interesting. No, that thought popped out of my head. Oh God, never mind. Yeah, I did have a thought, but it popped out of my head. No, not to worry. But yeah, absolutely, get in touch if you want to talk about this some more. I'm very happy.
That's lovely, and it's been great to see everybody.
Thank you for coming.